morning, ladies and gentlemen. Welcome to Bangkok Hospital presents Health for All show powered by Siamselite, where we will explore the key to a healthier and happier life. I am Dr. Sinthia. Today we have very special guest from Bangkok Hospital, headquartered Thailand. Let me allow to introduce the team from Bangkok Hospital. Today we have with us Dr. Porameth Charoentanakorn, Orthopedic Surgery, Spine Specialist. Dr. Paradorn Jetwanna, Thoracic Surgery, Minimally Invasive Cardiac Surgery. Dr. Chakorn Chansakul, Neurologist, Bangkok Hospital. Welcome to our health related show.
Thank you.
Hi, Dr. Porameth. How are you?
I'm good. I just arrived last night. I'm very excited to be here.
Is this your first time in Bangladesh?
Right, that's right. This is my first time.
Now we'll start our discussion. Orthopedic surgeon. Now
Right.
I am asking you one question first. Why Bangkok Hospital is more unique in case of a spinal surgery?
In our hospital, we usually use minimally invasive spine surgery with our patients. And that means the patients will get smaller incision, just only 1 or 2 centimeters. And the patients will get less post-operative pain, less blood loss, lower infection rate, and faster recover.
Thank you.
Welcome.
Welcome. Now we'll talk with Dr. Paradorn. How are you?
I'm good, thanks.
Welcome to our Bangladesh.
Yeah, thank you.
Is this the first visit for you?
This is my first time in Bangladesh and I'm happy to be here.
As we know, you are in thoracic surgeon specialist. Which type of surgery you perform in your hospital?
Usually I perform all kind of adult cardiac surgery, but I mainly focus in valve repair, valve replacement, coronary bypass surgery, atrial fibrillation surgery.
Dr. Paradorn, you are specialized in thoracic surgeon. You do a lot of surgery in your daily activities or daily practice. What do you think minimal invasive cardiac surgery and conventional method is same?
Big difference. In the past, when we perform heart surgery, or we call conventional heart surgery, it requires big incision cut through the breastbone. And for minimally invasive, we work through a tiny incision through the lips and use the endoscope. With this technique, we decrease the size of the incision to smaller and in the hidden area on the chest. And so that also have a lot of impact on the patients.
Thank you, Dr. Paradorn.
Thank you.
Hi, Dr. Chakorn. How are you?
Hello, Sinthia. I'm good, thank you.
Is this your first time visit in Bangladesh?
Yes, it is my first time and I've been enjoying it so far.
Dr. Chakorn, you already treated a lot of patients from Bangladesh.
Yes.
And you are expertise in various fields of neurology like Alzheimer's disease, Parkinson's disease, epilepsy, and migraine also. What is the modern treatment for migraine and other diseases also?
The treatment for migraine has changed a lot over the past 5 to 10 years. In the past, people they get medicines that are not designed to treat migraine. For example, they use antidepressant or blood pressure medication to prevent the migraine. But now we have the medicine that targets specifically to the protein that is responsible for migraine called CGRP. Because we directly target this protein, it reduces a lot of side effects related to the previous medications. So the patient gets much better outcome. And a lot of patients say that these are the medicines that change their life. So the treatment of migraine nowadays has much improved from before.
You get a lot of patients from Bangladesh. What type of common symptom or common diseases you get from Bangladesh patient or among Bangladeshis?
Actually, I have gotten various kinds of neurological problems from Bangladesh patients. Most common one, stroke. Because it's one of the most common neurological disorders in a lot of people nowadays. They are getting older because of the elderly society, so we have that. And we also have the migraine patients quite a lot. A lot of them also have the memory problems like Alzheimer's disease or epilepsy, which is also very common and can be consequences from stroke or other neurological problems.
Thank you, doctor.
Thank you.
Dr. Porameth, why minimally invasive surgery is more important or beneficial for patient?
When the patients choose minimally invasive surgery, they will get faster recover and they can return to their work very fast. than more than the traditional surgery.
Okay. What do you think, what are the most recent advanced treatment and technologies that you are practicing nowadays?
Yeah, in our hospital, we use the more advanced technology and safe for the patients, such as the O-arm imaging system. We also use with a 3D navigation system and also the intraoperative neuromonitor. And all of these tools allow our surgeon to make the operation more precise and safety.
Thank you, doctor.
Welcome.
Okay, Dr. Paradorn, what is the success rate and recovery time for patient?
Thank you for this question. We carefully evaluate the patients. I would like to say that nearly 100% with success rate. And after operation, patient is able to go home within 5 days after operation, and within 2 or 3 weeks after operation, patient can return to normal activities.
Do you have any other advice for our patient and what do you suggest them?
I'm a cardiac surgeon to give an advice them to have a healthy heart. First, you have to eat a healthy diet, avoid smoking, do a regular exercise, and manage your stress. If you have a symptom like shortness of breath, chest pain, or any fatigue, you should get early medical advice. And if you have a condition need to be operated, don't scare, don't afraid of surgery, because now surgery can provide excellent result. And now we also have a minimally invasive technique to help you to get a quicker recovery, less pain, and better cosmetic result.
Thank you, Dr. Paradorn.
Thank you.
Dr. Chakorn, you have treated a lot of patients from Bangladesh. What do you think, what are the common complaints of Bangladeshi patient?
So they can come in with a lot of complaints. For example, they can have like stroke, which is one of the most common neurological problems in associated with elderly. And nowadays we know that we are getting into the elderly society. And also migraines and headaches. This is also very common complaints for neurological complaints. Some of them come in with memory problems or like Alzheimer's disease. They ask for the treatment for that. We also see a lot of patients with that. A lot of them can also have seizures, kind of varieties. But I think the most common one could be the stroke.
At Bangkok Hospital, which type of investigations are more common for neurological patient?
A lot of them will get the MRI scan because it's a technique to get the picture of your brain without any exposure to the radiation, and we can give a very detailed image and give us a lot of answers. And as a neurologist, we need to make sure that there's nothing wrong inside your brain. So we tend to start with the MRI brain, but we offer other modalities also, like more advanced. For example, like in Alzheimer's disease, nowadays we can get the picture of amyloid protein, which is responsible for Alzheimer's when the patient is still alive, unlike before that we need to wait until the patient dies and then they cut their brain open to look for the amyloid protein.
Thank you, Porameth. Do you know in our country PLID is the most common diseases nowadays? What will be the advice for our patient or your patient? Do you think any other than surgery lifestyle modification can help for our patient?
Yes, the patients who has a spinal problem think that they might need surgery.
Okay.
But more than 80% of the patients can be treated with conservative treatment with medicine, physical therapy, and lifestyle modification to prevent surgery.
Do you have any advice or any suggestion for your patient or for our viewers?
You should take care of your spine. Don't sit for long periods of time. Don't lifting a heavy stuff. Instead of bending your spine column, you should bend your knee instead of your back.
Okay, thank you. Thank you, Porameth.
Welcome.
Dr. Chakorn, do you have any other facilities for Alzheimer patient in your hospital?
Recently, we have the medicines that is approved by Thailand FDA. It was approved by the United States FDA a couple years ago for Alzheimer's disease. It can slow down the progression of the disease. And we just use with our patients, and it can reduce the amyloid deposition in their brains, which will slow down the disease progression for the patient.
Alzheimer patient needs extra care.
Correct.
Do you have any other facilities in your hospital that a patient can care for?
Actually, for Alzheimer's disease, it's a long-term care, so the patient will eventually needs to go to their patients and their family. But we also have the multidisciplinary treatment approach to the patient. We have neuropsychiatrists, that they can perform the test for the patient. We have the rehabilitation specialists that they can do cognitive rehabilitation for the patient. Have the dietitian, because we know adjustment of some diet can also help with the patient's progression.
Thank you. Dear audience, now we are going for a short break. Stay with us. Thank you viewers for staying with us. Now we are going back to our discussion. Dr. Porameth, I want to ask you another question. When someone affected by back pain, then sudden how they know, is it for spinal or other reason?
It's very difficult to differentiate if the patient has just only lower back pain, because lower back pain can come from many places, especially muscle, the joint, the disc, nerve, or even kidney disease. And so if you have chronic back pain, it means if you have continuous persistent back pain for a long periods of time, maybe 1 month, you need to seek any advice from your doctor.
Okay, when someone suffering from sudden back pain, what will be your suggestion for them? Is there any option or any advice from you so that they can relieve from this pain?
At the initial, when you have back pain, maybe you can get relief with a common medicine like paracetamol, and maybe do some stretching exercise. But if it's not work, maybe you need to go to see your doctor for further investigation.
Thank you.
Welcome.
Welcome. Now we'll talk with Dr. Paradorn. Which type of patient is selective for your minimal invasive cardiac surgery?
Ideal patient for minimally invasive cardiac surgery is isolated valve disease or simple congenital heart disease such as atrial septal defect or tumor of the heart, or some patient with atrial fibrillation. Those patients is suitable for minimally invasive cardiac surgery. And we always carefully evaluate patient with our investigation, make sure that patient is safest approach for this group of patients.
Thank you, Dr. Paradorn.
Thank you.
Dr. Chakorn, could you tell us about updated treatment regarding epilepsy?
New anti-seizure medications have much less side effects compared to before. In the past, when the patients get the anti-seizure medications, they have long-term side effects, like they lose their bones, they have the liver problems, they have a lot of drug interactions. Nowadays, the anti-seizure medicine has much less of that. And a lot of patients with epilepsy will need to take the anti-seizure medications for life. So this is very helpful if we can get the medicine that has much less side effects for them. In addition, we can perform the epilepsy surgery, which can help control the seizures in a lot of people. When you fail 2 medicines for epilepsy, the chance of you getting seizure-free from the 3rd or 4th medication is much less. So we'd rather skip to the epilepsy surgery, and that will help improve the patient's outcome by a lot.
Thank you, doctor.
Thank you.
Dr. Porameth, what do you think when someone sudden back pain occurred, then she or he do X-ray, or is there no need to do any investigation first? First, we have to take paracetamol and then we have to consult with doctor or take advice from them?
If you have a severe back pain, you should go to see the doctor to differentiate where's the pain come from, because sometimes you need the further investigation. If you have severe back pain with a neurological deficit, sometimes the patient don't know they have neurological deficit because the patient can walk, but when we do physical examination, the patient realizes that they have weakness.
Thank you, Porameth. And doctor, I want to ask another question. Nowadays, many teenage and many younger people are doing exercise every day. When they do exercise in the gym, then when they weight lift, at that moment they feel pain. What do you think, weightlifting is good for all, or any restriction for some patient, or any restricted for teenager or younger people also?
Yeah, you can do weightlifting for the exercise, but you have to have a training coach. You have to be careful when you bend forward and with the weightlifting. That's the dangerous exercise because your spinal column will bearing the weight a lot in that position and can cause disc herniation.
Thank you.
Welcome.
Dr. Paradorn, what do you think is the success rate of minimally invasive cardiac surgery?
With our experience and with our carefully preoperative evaluation, most of patients surgically successful with our operation with minimally invasive technique.
Thank you, Dr. Paradorn.
Thank you.
Dr. Chakorn, sometimes in our country, many people are forgetting everything day-to-day of work activities. What will be your suggestion or advice for those patients regarding amnesia?
Yes, for memory problem, it's very common, and I think everyone has it from time to time. Most of them are not demented yet. But actually dementia, especially for Alzheimer's disease, is fairly common. So my suggestion is that if you sleep well, you eat well, that can help slow down the progression of the brain, because the dementia, the memory problems, usually result from the loss of brain cells or synapse. If you save those brain cells or synapse, that will help slow down the process by a lot.
Thank you. My last question, what will be your advice for our viewers and for our all?
If you want to have a strong brain, first, you are what you eat, so you need to eat well. Second, you need to exercise a lot, because when you exercise your body, you also exercise your brain as well, because your brain tells the body what to do. And if you sleep well, that will help improve your brain health a lot, especially with the memory. Now we know that if you have deep sleep, we can clear up the toxic substance that can damage your brain. So eat well, exercise well, and sleep well will help to have a strong brain.
Thank you so much, doctor, for sharing your valuable insight with us. This is your first time visit in our country. I hope you will enjoy here.
Thank you.
Thank you.
Dear viewers, thank you for staying with us. Until next time, stay healthy and take care of yourself.